Okay, we're going to come back to the Health Alliance building. We had talked earlier about the Kannapolis COPS issuance of approximately $31 million, which the county is in discussions about participating, and to what extent. We had the previous discussion and presentation by Mr. Legg, and we have some information. Dr. Pilkington is present. Right now, we have I think everyone has a spreadsheet of the anticipated cost of the Health Alliance building of approximately $15.1 million. At this point in time, I'll turn it over to Dr. Pilkington to elaborate a little bit more. Any more that you want to talk about, Dr. Pilkington? Or
Sure. Thank you, Mr. White. I have with me Bill Caldwell, who is with Cox Shep, who's the contractor that has been awarded our building. So if you have some questions, particularly about the building, I'm sure he can answer them. Earlier, you had asked questions about what was the difference between our cost and our furnishings. One of the things, if you remember from the presentation back in the spring that I did, our building is an open office building, so it's like this room. And so everything is built into it is furnishing. So we'll be putting in modular furniture inside the building. Our cabinetries separately, if you see that, modular cabinetry so it can be hung on the walls, taken off. So the building can be used for different things as times change and needs change. What we saw in looking at other facilities when we looked at what people did with medical office buildings was they built in permanent fixtures. And what happened is when things changed, you needed less exam rooms or more exam rooms, you were stuck. You had what you had. The way our building is designed, you just hang the cabinets on the wall, you hang the sinks on the wall, you hang everything. The plumbing's there already. You use the plumbing, you take the plumbing away, and you can use the room for an office if necessary. Within this building, there are no private offices at all. Everything is modularly constructed, so including myself, everyone else, no one has an office. So that's the way the building will be done. None of these modular workstations will be higher than 42 inches so everyone can see everyone else. That was critical to us too. We wanted to make that so that we could make use of the lighting in it so everybody had access to lighting. Plus there's a nice thing about 42 inches, you can see everybody working or not working. So we wanted to do that as well. And so that's kind of the overall design. Now when you get down into what our cost is, you look at that construction cost of $7.673, and that is a rebid 3 times, I think it was. And so that bid is good with Cox Shep through December 31st at this point. We expect, and Mr. Caldwell can answer those questions better now, that there will be some steel increased prices and some other cost increases after the first of the year that are already occurring, that have occurred since we locked this bid in again. So you'll see some increased costs if we don't do something by the December 31st date. If you look at that middle category, which is number 2, I think those of the folks in the county who've worked with construction before will tell you that most of those things are included in your construction cost in other buildings. That's why that cost is there. These things are generally seen when you look at things like modular cabinetry, cabling, wireless network infrastructure. All those things are generally in a construction cost in a building. What we did was bid those things out separately because we felt like we could get better deals on them, and we think we did. So we took even carpeting. They're not doing our carpeting. We took carpeting out and bid carpeting out separately. So all those things are bid out. So if you see the real cost of the building is about $10 million, which gets it closer to what a medical office building goes for. Medical office buildings are somewhere in the neighborhood of 140, 150 per square feet, and we're down around 108, 110 right now with our building. So it's right in that medical office building cost. If you look at the medical office building that will be on the campus, it's 240 feet, $240 a square foot unfinished. So we're way even under that. So there's a good cost savings in what we're talking about doing in this way. Also remember about health facilities and public and medical facilities is that there's a lot of plumbing. Everything has to be, water has access to everything. We're doing dental. Dental is really expensive to do. And we're doing a new dental clinic in this building. So that costs a lot more. This is not like building a bunch of offices in a county governmental center. This has got to have plumbing in every room and access to it and ability to change that if you need to change it. So that's kind of the overall design concept. So I'll just stop with that.
Any questions for Dr. Pilkington?
Well, I'll ask about the dental equipment. I think you said that you have a Canon grant.
We do.
So is this amount in addition to the Canon grant or less?
This is
Take
in
that
addition
amount
to
less
the
than,
Canon
in
grant.
addition to.
Yes.
So you're looking at $740,000 worth of dental equipment.
Dental equipment and the area that the dental has to be in as well.
Is this going to be a duplication of your clinic you already have down at the village?
Yes, it will be a duplication since we'll have 2 dental clinics. No, in the sense that we have sometimes as much as 6 to 8 weeks waiting list. We cannot do adults at this point in time hardly at all because we have so many children waiting. And it can be, depending on whether or not you're dealing with an emergency situation with a child, it can be 2 months before you can get into our clinic. We are primarily the only Medicaid provider for dental care in the community. So if you have Medicaid, you come to the Public Health Alliance, and that's just creates a huge backlog in terms of who we can see. If you go, right now we're trying to see a lot of folks who go to the emergency room for dental care adults, and we only take those on the most dire emergencies. And what we would like to be able to do is get it to the point where we don't have such a backlog of the adults as well as the children.
Why have 2 dental clinics then? What's the justification of 2?
Well, the locations are 2 separate locations. A lot of these are children. We serve them through the schools. We feed them out of the schools into our dental clinic as we go to the schools with our mobile dental clinic and find problems. And that way, if we find someone at Shady Brook School, for example, we can get them to a Kannapolis clinic. People don't seem to get their children in for dental care as easily as they do as other things. It's more an optional care, so it's the closer the location, the likelihood they'll be seen is better.
All right, if it's advantage of having a dental clinic in a central location, why not the whole facility?
Well, what we're trying to do with, as I said here, is we have 2 locations for dental clinics. They'll be in Concord and Kannapolis, which are our 2 primary population areas. What we do with our other services, we don't just serve people out of Kannapolis. We provide primary care, clinical services in McGill, at the McGill Community Health Center, in Logan, at the Logan Health Center, and then we, of course, have the dental clinic at the village, so we are scattered out. And as I pointed out to the commissioners before, we have a school nurse in every school in the community. They're full-time when the schools is in, so we're probably outplaced better than anybody in the community in terms of where we are in the community at any time.
If the building, if the Health Alliance building were located at the old fairgrounds, then that would that we wouldn't have to duplicate on the dental services, correct?
We would probably do a dental clinic in Kannapolis anyway, somewhere. Eventually, we're going to have to do something there because of the need for a dental clinic.
Okay. And the dental treatment, or the payment for treatment, is a wash, or is it somewhat of a?
It's actually a profit maker
Okay.
for us. What we do with dental and our board, which you're on, Mr. White, 70% is our number we'll see of Medicaid, and the rest is no pay because some kids don't qualify for Medicaid. And with that, we can net in the neighborhood of about $300,000 a year of our expenses. If we did solely Medicaid, we could probably net $600,000-$700,000 a year just in dental care. But the board has made the decision that our primary purpose to be in the public health business is to serve people who don't have any ability to pay. So we've set that goal as a board of 70-30, and that's the way we schedule our appointments each day.
Okay.
You got any idea how many dental clinics, say, there is in Rowan County?
I have no idea.
How about Davison County? You got Thomasville, Lexington.
I don't. I know that one of our former dentists works in the Rowan County Health Department, and they have very limited hours for, they say. We actually see children. Commissioner Poole asked me this question last night. We actually see children sometimes from as many as 12 counties in dental care. The reason being, if they have an emergency and they can't get dental care in Stanley, they can't get dental care in Davidson, and it's an emergency situation, we'll take them because we'd rather do that than see a kid with an abscess going through their jaw and not be treated. And they just can't get into private treatment. So we've taken kids from all around, depending on what and not for money necessarily. Most of these kids have no source of reimbursement. It's just a dire situation. The public health department calls us and asks us if we'll see them, and we do that.
Well, doesn't the fact that we're being a nonprofit health alliance versus the county health department help to enhance the fact for our dental services? Because that's not. the health departments have very limited ability to do any kind of dental treatment, right?
They do, and the critical thing for them is they're limited on what they can pay dentists. And dentists can make quite nice salaries in this day and time. And because of that, when we were the county health department, we always lost our dentists on a regular basis. We have 6 dentists now, and we never lose them. We can pay them well enough to keep them. The other counties will hire a new dentist right out of dental school, keep them 1 year, and lose them to private practice. And that's, again, part of the reason what happens. Say a Stanley County hires a dentist like that. The dentist leaves, and they're 6 months without a dentist, so that all that time, their numbers are just stacking up. So we, again, try to help them with emergency situations in those cases.
What, I know that email you sent us today about the talking about a lot of discussion about the centrality of the Health Alliance. And I guess, you know, the fairgrounds is kind of the geographic center of the county, but the population, how do we determine the, I guess, the demographic distribution so that, you know, you said 70% of the folks?
Yes, it's interesting because when we were moved to Kannapolis, it concerned us as to whether or not we'd be able to serve the same population or would we lose patients at that time. So we ran the numbers of our patients, and we found that our patients came from within 5 miles of either side of I-85. 75% of them all at that time, and this was in 1997. What we found since then is that even though we changed locations, it's still the same numbers because the primary population centers of poverty in our community are Concord and Kannapolis. So that they're going to always be in that proximity. So we're going to be very close to them whether we're in Concord or Kannapolis. And as long as we're on a bus line, that's the critical thing. We need to be on the bus line because about 10% of our patients get to us by public transportation. The rest get to us by private automobile. So. And some walk, of course. So.
Well, in regards to the sheet, I think you have it. It does, I understand the mobility of the furniture. It does, that's my math, and if I'm wrong, please let me know, but it looks like that's the $1.7 million figure is 22% of construction. And the law enforcement building that was built is very similar, like you're talking about it. It's all open area like we have here, so it has modular. And I think what Mr. Downs earlier said was those costs, the furnishings there, is that correct, Mr. Downs? It was about 2 to 3%?
For the total project, yeah. We had some areas that were open like this, but we had a lot of hard walls.
Oh, they were, okay. Okay. I think that number kind of concerns me. And then a number that always concerns me is whenever we're financing things that don't have the life of a loan, such as computers, copiers, if that's the case. So those are little things that I guess they're nitpicky, but they still concern me that when a computer's not going to last 10 years or 20 years, how, you know, should that be financed or not? So we got to figure. I think we need to figure out what needs to be done there. And also, the location is, if we could place the location at the at the old fairgrounds, that would save $2.5 million off of this estimate. So now we're talking about roughly $12.5 million or $12 million or $13 million if my math is about right. Can you talk about the location? Would there be an issue with it being at the old fairgrounds? I mean, if you use the building and just move it over there?
Having been across the street, the only concern I have, and I haven't had a chance to talk at length with Mr. Downs about this, but I know there's a lot of rock, and I know from some of the construction around there, you could run into quite, you know, Mr. Caldwell can probably answer that better than I, but I don't know what the geotechnical work that's been done there is, but there would have to be substantial geotech work done there that would indicate that the rock is not an issue, because it always has been in that particular area.
I think we've done a lot of that geotech already, and in fact, I think that earlier this year or the latter part of last year, more borings were done than normal to make certain, like you were saying, is where would be a proper placement for the building. And I think that was for a building that was going to be about 25,000 square feet?
It was 25,000, footprint was about 12,000.
Okay. And this footprint is about 15,000? No,
And it's probably closer to 20,000, 22.
20, okay. Okay.
There are 2 buildings, footprints in there.
Okay. And that was one, or?
That was when we had actually three pads, or
That's
three
right,
different
right.
locations that
Right,
we had
3
looked
pads.
at. One were, 2 of them were actually larger than the one we were going to actually build, so
Yeah, and
they were to the rear of the property.
the rock outcroppings have been mapped and everything, so
Right.
there's been a lot of work done already.
Okay.
Mr. Chairman, on the location, I get a lot of my public policy information from the locker room to YMCA. And since it's been in the paper, some says, why in the world are we considering building a health facility up near Rowan County? And folks from Harrisburg, Mount Pleasant, Midland got to drive all the way almost to Rowan County for a health facility. I said, well, the original thinking was it's going to be a part of the research campus, but that got shelved because of the cost. But anyway, their thinking was that this is interesting. It's in the Kannapolis YMCA that they could not justify or think it's good public policy to build a health facility almost on Rowan County line.
One thing that, and following up with Commissioner Privet, is I received over the weekend a letter from, that I forwarded on to everybody. I want to make certain everybody got it, or at least knows it was emailed to me, and I forwarded it on to y'all so that y'all would know. That was the concern that this person had, was locating it in Kannapolis as opposed to more centrally located.
And
Commissioner
I
Poole?
spoke to
Oh,
the same, I did speak to her, and that was her concerns too. And I've had some other concerns about the same thing, to see if we couldn't locate it more centrally. I think the actual geographic center is the current fairground, so I think more, as you were saying, that population center is more like the old fairgrounds, and there is bus service out there. And we talked about that when we were talking about putting our own building out there, that having a bus stop and everything else. The other item that I agree with you on, the construction-related cost of looking at that and deciding how that should be paid for, if it all should be financed for a longer term than its life. We've done that a lot with the schools. We've talked about that on how long to finance things. I'm also concerned about the artwork allowance of that amount, that seems to be a big number that could probably be reduced. I would think $90,000 for artwork is a lot that's in there for the related cost. Now, I know that you've got the bid on the building itself. Some of the related cost, I would presume, you have a few of these that say bid awarded, so I know that you've actually gotten hard bids on it. I don't know if you've gotten the hard bid on the furniture. You just have the allowance. You
We
haven't
have a hard
actually
bid on the furniture through December 31st.
of that amount.
Yes.
Okay, and then which of these other ones do you have hard bids on? Is there something that you?
We pretty much have a hard bid on everything there. Other than artwork, we don't have a hard bid on, of course. We have the cabinetry we have a hard bid on with Nurture. Almost all the audiovisuals, cabling, we have hard bids on. So those, other than optional things like artwork, they're bid.
Is there any furniture from the current facility or computers and any items that you would take from the current facility into this facility
The
that would
computers-
offset this, or you've already taken that into account?
With the computers we would take, we keep our computers very much up to date. The things we would not take would be the existing modular workstations, which are
Old,
old and outdated, so, and ugly. So,
okay. But as far as if we wanted to go towards eliminating this $2.5 million land cost and putting it on that site, and I presume also next to that you have where you spent $240,000, that would be property you could put back on the market?
Certainly, we could put it back. I don't know how, if it would sell or not, we could put it on the market.
The timeline on it would be debatable, but at
Yes.
some point in time, it would be sellable, so that would be money to come back in and on the backside somewhere. I guess that's one of my, personally, I think we can do better on artwork than $90,000, and if we could get rid of the $2.5 million, I mean, that's $2.6 million almost that we could cut in the cost right there by putting it on property. We would need to have some money, I'm sure, for some geotechnical work, even to back up with what we have, so it wouldn't be a complete swap out, but I'm, I would think that with all the work that was already done on that site.
Yeah, we've got the information there. One of the things that we were looking at when we were when we were proposing to build the building there ourselves was there's somewhere between $408,000 or $900,000 worth of site costs that will be with utility relocations, curb guttering along Union Cemetery Road and Cabarrus Avenue, and then also some stormwater. Stormwater, the ponds are in, it just to get from the buildings wherever they're going to go back to the pond. So there'll be some meandering around some of the rock outcrops there as well.
I don't want to digress, but if we're retaining the water that's going onto that property, why do we have to do curb and guttering?
That's the city code.
It kind of brings, that kind of brings up my point, and not to play devil's advocate here, but I'm thinking on that, there is one thing, I've got three things here that I bring up, and that's one of them is that we know, or, well, and from building schools, and we know from building the jail, that once and there's another rock, I mean, let's use that term, but that when you take the plans over about 2 blocks over here, then suddenly things start getting added and changed, and additional requirements put on the project, as we saw, and that's like curb and guttering or turn lanes or, that get added to it and requirements by the city when they do their plan review. And I guess that's one question, was that, Mike, you said, how much is it? $400,000 or $500,000 for what we're looking at as far as the
I
city
think that what we
parcel
looked at
building?
was probably a minimum of 400, and there was potential between 400 and 800,000. We could never get a true number because we were still negotiating with the city as to what utilities were going to have to be moved, and when would the sidewalks have to go in? Would they all go in at one time, or could they be phased and that type of thing?
Yeah, and it was a little more complicated, and one of the reasons is because it was more complicated because we were looking at 3 building pads and perhaps phasing development, and we couldn't really give them specific answers about when or if these other phases would be built. So those complications, of course, would not exist in this instance.
Did you address DOT at all in terms of DOT's requirements for things?
We had discussions with the city of Concord and DOT through the city of Concord as well.
Because
Yes.
I know in terms of our site that we're currently looking at, DOT costs were going to be turn lane and some other things that were
Right.
requiring in 2 directions. So,
Right. Yeah, there were some requirements. Cabarrus Avenue was sufficient at that time. There was going to be some requirements for Union Cemetery Road at Cabarrus Avenue, the widening and turn lanes and that type.
What is the life of the dental and medical equipment? How often do you have to change that? Because it's sort of like financing your washer and dryer and your mortgage. It's not the smart thing to do.
that's one of the things we did when we purchased this purchased the bids, or advertised the bids on this. We required lifetime warranties on the equipment. So they're all good for 24/7 use for as long as we have the products, and if they wear out,
Well,
they
that's my
replace them.
question. How long do you have the products?
A dental clinic, should last in the neighborhood of 20, 25 years, maybe more. And some dentist I go to has equipment older than that. So it should last fine. But the important thing with the dental equipment is dental equipment to be replaced is expensive. So we wanted, if an arm broke, the arm would be replaced at no cost to us. So that's the way we constructed our bids, so that they're responsible for replacing anything that breaks over the life of the equipment.
And I know it is a small amount, but small amounts add up. It's somebody's tax money. When you come to the artwork allowance, our schools have some marvelous artists in the high schools, and I think, you know, if no matter where this is located, that's an avenue that you should look into, because you can probably get those for nothing or a small amount in framing. So.
And I think that in the presentation, Dr. Pilkington was saying that he wanted more of, the Health Alliance Board was wanting more of a local flavor or regional flavor in regards to the artwork. And one, you know, the Arts Council, a lot of those artists put things on loan, because I know through, well, I don't know, but last time I went through the Sheriff's Department,
Yeah,
they have artwork that stays on display for people to look at, so.
One of the important things that we want to do with this building is that a lot of our history has been lost. So if you saw a history wall in here, and it'll be more than $13,000. To do a good history wall, we want to bring in something that shows the development of the history of healthcare in Cabarrus County. For example, we were the first community in the entire United States to immunize its population against polio. We'd like to show that as a big deal, because it was. And that was through a grant from Mr. Cannon to do that. We would like to be able to display throughout all the important things that happen in healthcare in the community. You can do it cheaply and it can look badly, but it's going to be the main entrance to the building, so we'd like for it to be something that's a source of pride that the whole community uses. Public health is usually something that people only come to when they're needing public health services. It's their last resort. Part of the idea of this building is it's not going to be that kind of building. It's going to be a whole community's building, so that it's used by the whole community. It's got an education area built into it with computers that people can go to and use them to pull down healthcare facts that they need. So it's going to be that kind of facility, and not what you normally would see in a public health building, which is you walk in, you got the gray walls, the gray floors, and you go to the clinics and they're all gray too. So the whole idea was to build this thing so it would be something that would be a model public health department for the rest of the country. That was our goal to do.
And getting back to the artwork, and I understand what you're saying about a feature wall, have you talked with anyone within the county or with the Arts Council, so that as much of this is done here in Cabarrus County rather than going elsewhere to?
We have not, and we didn't intend to go elsewhere. The allowance in there is an architectural allowance. That's what they build into their, I guess it must be an architectural allowance that they're used to doing in other communities. So that's not a figure that we're stuck with. It's just what they put in the allowance for the budget.
One other question, and I know Rich maybe bring you on this, is that, I don't think anybody's even asked this, can we, if the building is located here in Concord, can it be owned by Kannapolis? Because it's physically located in another municipality.
Yes.
Can. Okay.
They'd have to have title to it, but they can purchase property in another municipality.
Okay.
That's what I took from Mr. Legg, was at the end of once it's paid off, then it would be reverted back to the county or the Health Alliance, whatever the board is asking for.
Okay.
Any other questions for anybody? In roughing out numbers, using the $15,184,799, if we were to take out the $2.5 million land costs, with the idea that it gets that we would recommend it be relocated at the old fairgrounds, taking out the $100,000 for the artwork, I've got a number of $12,584,799. If we were to add in the cost that Mr. Downs was making or referencing in regards to the possible upfits, that would be added $800,000, which would take the price up to $13,384,799.
There is some site work already included in here, so.
If I may,
Yes, sir.
one issue that we already have in our price, the site cost and the grading, paving. If you do move it to a new site, you're going to part of that money, it may take care of the actual work over at the new site, but you are going to have to re-engineer it, and there's a time issue. The time issue is to redraw, you know, the current drawings, adapt the existing building that's drawn on the new site, and then site adapt that, and then it'll have to be, you know, the parking, paving, curb and gutter, storm retention, any of that would have to be designed. I don't know the cost of that. That wasn't in our bid, but I would speak for Dr. Pelkey, that is going to be an additional cost. So it may net out of that savings of the site that you say, but there is going to be an additional cost plus a time issue.
So am I hearing you correctly that you think that the site prep for a different location is going to be roughly $2.5 million?
No, sir, I don't know what it would be, but I'm just saying that there is not a total savings of that 2.5. Some of that, I would imagine, would have to go to engineering the new site to adapt it, and it certainly can be, but I don't know that that's in your number. I haven't seen that.
Okay.
The question then, I guess, is that if that's the time-wise, I think it's got me concerned more than the cost of it. What does that do as far as, I don't know whether y'all can answer this, what does that do in regards to the overall cops issue? I mean, if we, I don't know whether that's probably not something y'all can answer, but, you know, how does that delay that going forward? And then, you know, does the whole project get rebid, or just that part of it?
Well, I don't know how long. I don't know if it's a 3-month process, but, you know, if it were me and there's an opportunity to go to another site, we would be more than happy to look at it from a site adaptation to see what that cost might be, to see if, you know, what the increase would be. And then we would have to get with the engineers to see how quickly they could get it. You know, they could put documents together, and then it would be a process of getting approvals, site approvals. I think we already have drawings that have been approved and ready to go. This would have to go through engineering and the site review for the county and the state, and I think there's probably I don't know if National Stormwater has to look at this. I don't know the site, but I'm just suggesting that there is a process of site that has to be considered as an additional cost, plus it's a duration that has not been figured into the duration right now. And we're here to help. Just let us know what you want to do.
And you're not from the government?
No, sir. But I mean, I think I'd look at, you know, if you do want to go to a different site, the worst thing to do is to go to another site, do all the engineering, find out that you've got, you know, $1.5 million premium of site cost over what we've already estimated. I think that would be, I don't think anybody would like to hear that news. And we'd be glad to do that. It seems to me we better do it in pretty quick order. And I'd be more than happy to do that. But once, if it is a decision made, then y'all would have to buy engineering services to get that documented, and then we would, I'm sure, price that and work with you on the difference in costs and that sort of thing. But we're willing to do whatever we need to do to make this happen.
We're not going to vote anything tonight. We're going to vote in 2 weeks. So would you be able to have information, at least some idea within 2 weeks? I don't know. That's just a question for you.
I can do anything I'm asked to do, but I think that somebody else has got to get an engineering drawing. I can look at the documents. If Mike, if you've got something that you can show us, you know, we can look at it and we can advise our client, you know, what the difference in cost would be.
Yeah, we can get the topos and the geotech to you in the morning.
Okay, if you can do that, we'll be here bright and early and get them, and then we'll take a look at it. But I would suggest that we need to get an engineer to look at it as it would lay out, so.
Okay.
I mean, I'd at least like to have the information on that, because I do think that's what our discussion, at least individually, has been about being more centrally located. So I'd like to at least see if that's a feasibility, dollar-wise and everything else, you know, that would make it work.
Any other questions? Okay. If we have any other questions, we can just get it to Mr. Day so he can forward it on to Dr. Pilkington so that we're all understanding what the questions may be and that the information can be dispersed.
Just one last question.
Yes,
Is
sir.
the cost of doing this kind of engineering work are going to be there? Who's going to be paying for those? Because I've got $800,000 out already. I have no money to pay for any additional cost.
I think what would be good is we can just get a figure out what it is going to run to get some ballpark numbers, and
Okay.
we can go from there.
Okay, so no money out of pocket right now. That's what I'm trying
Correct.
to get. Thank you.
Thank y'all.
Thank you.
Unless I'm mistaken, that wraps up all the business that we have today other than a closed session. Do we have anything else to come before the board? Do we have a motion to go into closed session to discuss?
So moved, Mr. Chairman.
Second. Figure out which statute.
To discuss pending litigation and to preserve the attorney-client privilege. We have a motion, we have a second. All in favor, say aye.
Aye.
All opposed? Motion carries. Thank you.